Good afternoon. We're so grateful to have so many of you join us today for this session. We're coming to you live from Ann Arbor, Michigan. I'm Sharon Cardia. I'm a professor of epidemiology, and joining me today is Jason Juan Rodriguez. He's our online MPH admissions coordinator. This is the second in a series of live online sessions that we're going to be hosting leading up to our launch, fall 2019. We are hoping to introduce both the School of Public Health here at the University of Michigan, as well as to sort of fill in some of the details on our new online Masters of Population and Health Sciences. If you have questions, please post them. We're going to try to get to as many as we can today, but we'll certainly post answers if we can't get to everybody's questions. Last March, when we announced that we were going to offer this MPH partnering with Coursera, we did it because Coursera is such an incredible partner for us at the University of Michigan. And the University of Michigan was one of the 4 founding partners for Coursera way back when they started. And we really have a commitment to trying to get our education out to people so that people can have access way beyond our residential program. So why pursue a public health degree? Let our students and alumni share their reasons with you.
I pursue public health for health equity.
My pursuit is optimizing the health of pregnant women and newborn babies.
I pursue effectiveness in corporate wellness.
I pursue women's health through breast cancer prevention.
To make people healthier one person at a time.
To improve communities of need through the provision of health care.
I pursue a cancer-free world.
Health and wealth are positively correlated, so if I can improve the health of a community of need, I can improve their viability as a community.
I was pre-med for a little while, and then my dad had a heart attack.
I did my undergraduate degree also at the University of Michigan, and I studied neuroscience.
I kind of realized doctors are really good at curing illness. They're not really so good at preventing illness, so I got interested in public health to prevent.
Public health really gave me the opportunity to be able to marry 2 of my big passions, which is social justice and academic research.
I realized that I didn't think I could make the most impact doing basic biology and instead wanted to focus on population health.
I came in HBHE, and because that was my background in this more the social aspect of health, and I didn't realize that I was good at statistics, to be honest, until I took the intro classes and I rocked them.
I loved my experience here at the School of Public Health. I really did, and I graduated quite a while ago. It's been 19 years, and I am still very connected to the school.
I decided to pursue epidemiology as well and see how I can use numbers to strengthen my goal of improving health.
It was really cool knowing that there is already something that you have in common with a lot of people here, that there's a shared interest and passion there. And I think that's a great platform or springboard to form those academic relationships as well as social relationships too.
The 2 things that I think it's most important to walk away from the School of Public Health with are good communication skills and good collaboration skills.
As I was considering public health programs, I was debating between Michigan and another institution. And as I went back and forth between the 2, I was able to meet some Michigan School of Public Health alum. And in speaking with them about their program experience and the support that they had, I just knew that Michigan was the place to be.
Everybody has a unique trajectory into public health. I started in human genetics, and most people think, what does human genetics have to do with public health? Well, my dream was to study and identify why some families have early heart attacks or early onset cancer, and really that's a genetics question. So my work and my research really focuses on looking at populations of people and their risk of diseases like heart disease, high blood pressure, diabetes, cancer, and identifying those root causes. And there's no better place to do that kind of cutting edge work than a school of public health that really is dedicated to the health of populations and has the sort of skill sets to be able to marshal large studies. We work internationally as well as across the nation. And this is some of the kind of skills we would like to be able to impart to people who are doing the online degree. The way that we have organized this online learning experience is really so that people can identify where is the greatest need in your community or in your business for addressing health disparities, or for instance, certain root causes. They could be environmental, they could be behavioral, they could be in policies. And an online degree in public health will give you those skills both in its breadth as well as its depth. In particular, the curriculum that we've designed is just 20 months, a little bit over a year and a half, 5 semesters, that has the foundational courses in epidemiology, biostatistics, program planning and evaluation, environmental health, as well as health management and policy, so that everybody comes out of here with core basic skills in these fundamental fields. And then we'll allow you to sort of narrow in on elective series that could be anything from how to analyze health data, or maternal and child nutrition, precision nutrition, or survey methods, program planning, a whole suite of different deep engagements with the public health material that we teach every day here residentially. A lot of people are wondering about what's required in the application. Jason, what are the requirements that we have?
Thank you, Sharon. And thank you and welcome to everyone who's joining us live today. You might be asking yourself, who is this program for? So I'd like to begin by saying this program welcomes learners from varied backgrounds, health professions, industries, government and non-government, and organizations who are looking to advance their career. I think we'd like to think that what we're aiming with this program is a program that meets you where you are, and then together just kind of journey to the next steps. So in terms of actual logistics and requirements, your first few things you're going to be looking at is the SOFIS application. You're going to want to have all your transcripts for all schools attended. The minimum requirement will be a 4-year bachelor degree conferred from a regionally accredited U.S. institution or an equivalent. And if there are any classes or a program that you did abroad, you're going to want to have a WES evaluation verification for that. After that is your statement of objectives or purpose, and that's going to be around 1,500 words, and then following that is a 500-word reflective essay. Just a little tip, I would say, in those essays, use it as your chance to really show up. Who are you? How do we get to meet you? And all get excited together when we're going for the reviewing process. So that's always my tip. I think when folks are filling out the applications, they're kind of thinking about, well, what does the school want to hear? And I think for us, what we want to hear is who you are, because that's what's going to make the program. And then after that, you'll just want to have your resume and cover letter, and then 3 letters of recommendation. And then the not fun part will be the GRE and MCAT requirements. However, it is worth noting that if you have earned a degree from a regionally accredited institution, you can ask to have the GRE and MCAT requirement waived. So hopefully that helps. Another question many of you want to know is around timing. So our first cohort is going to begin in fall 2019. As we begin accepting applications for the class, which started this past January 2019, we're going to have 2 priority deadline applications. The first one will be March 1st, and the second one will be April 30th. So we encourage you to apply specifically by March 1st for consideration for admissions. And you'll see a link following where you can find some more fuller information that we have. The next big question, of course, tuition. Costs. What are we looking at? So the online MPH tuition rates are anticipated to be $960 per credit hour for Michigan residents, and for out-of-state, $1,060 per credit hour. These are anticipated rates, and they are subject to change pending approval from the University Regents of Michigan, which should come in June 2019. Scholarships are available on a limited basis, and they're being earmarked specifically for students who are applying to this program. And that's really where your priority deadlines will come into play. The sooner you can get those applications in for March 1st, ideally, or April 30th, the better your opportunities will be considered for this pool we're trying to have in order to support the students as best as we can. And please don't forget, if you want to be considered for potential federal aid, please make sure to fill out your FAFSA as soon as possible, because that'll go a long way during the process as well. So I think that's the nuts and bolts of some of the stuff. So now let's move on to some questions that some of y'all have posted. Please add as many as you can. Whatever we can't get to right now, we'll be sure to get to at some point, because we want to answer all your questions. So the first one, Sharon, how long will it take to complete this program?
So we've designed this online MPH to take just 20 months. Each of the courses have been designed to basically be offered as a single course at a time. So for instance, we've taken a semester's long material and made it into 6, 4, or 8-week courses that students can really focus in on just one course at a time, 10 to 15 hours per week, and get a sort of deep experience within each one of these courses. And that we're really hoping to work side by side with every student so that they can make it through in just 20 months and get the Masters of Population and Health Sciences done.
And we kind of already touched about it, but I do think it's worth clarifying again, because it will come into play. What's the benefit of applying to the March 1st deadline?
Well, we only have 60 slots in our first cohort, and we really would like to be able to start working with people that are qualified and start to do onboarding. And we also talked about the scholarships, but we'd like to be able to pull you into the University of Michigan School of Public Health family early and start to be able to work with you in getting, I was going to say, a family relationship. We've got very strong relationships with our students. Most of the time they're reaching out to faculty before they even come, and we would like to learn more about you as well as to get some of our faculty getting ready for this new cohort coming in.
Okay. Are a list of courses available yet?
So we'll be publishing those with Coursera pretty quickly. The first year is really the foundational courses in epidemiology, biostatistics, nutrition and population health, environmental health, health management and policy, and population health. So those are those core ones. And then we have slated basically about 30 different electives for the sort of spring, summer. It'll take 1 or 2, and then the fall.
Okay.
So those are coming out very soon. We're working with Coursera every day.
You certainly are. And what specializations are available?
So we have specializations, I would say sort of elective series that are focused on epidemiological methods. So how do you go into a community or any population and be able to figure out what are the determinants of disease, what's the distribution, who has what, how many new cases of disease are coming into a community every year. So that's epidemiology. We also have a biostatistics elective series that's analyzing health data, getting the hands-on skills of programming in R, and then even how to do things like project out into the future. How do you do predictions? We've got a couple of series in nutrition. We've got one in maternal child nutrition, one in precision nutrition. We're developing ones in environmental health, occupational exposures, as well as in sustainability and climate change, and ways in which the environmental health sciences really can help improve people's lives. We've got a whole set of different health behavior, health promotion, health education elective series that we're developing. So it really is all 6 of our departments sort of showcasing some of the depth in their areas in these elective series.
Okay, nice. I'll take this one if this is all right.
Okay.
It asks, are scholarships available for international students? So this is a great question. For our inaugural launch of the program, the first year, the program is only going to be eligible, applicants who are eligible for the first year are going to be domestic, permanent residents, and citizens of the United States. That's just for the first year. There's reasons for that, trust us. But the aim is so that we can gear up, and hopefully in the near future, we can bring this live to our online community, which we're very excited about doing.
Yeah, I mean, one of the things which we haven't talked about is that some of the material that we're developing, we're also hoping to put out in the massively online space, the MOOC space, that international students would be able to access. But we are going to take 1 year to get our sort of feet grounded in this first cohort through before we invite the international students.
And why is it called MPH in Population Science?
Well, the Masters of Public Health is a foundational degree within the school. And we picked Population and Health Sciences because we thought it represented the real breadth across our 6 departments. So if in a department, let's say it's epidemiology, you would get a Master's of Public Health in epidemiology. So we were trying to find a way to describe both our focus on populations and our focus on the science of health. And those 2 things are what we really bring to this new MPH.
So it's kind of a more macro look.
It is, but as I described in those elective series, people can really take that foundational first year and apply it in so many different arenas. We wanted something that people could actually have a lot of choice and then be able to still get a lot of depth in it. And that really is Population and Health Sciences in a nutshell.
Yeah, I mean, one of the things that I was excited about joining this was the way in which we were designing a program that would shape around each individual. So I think that that's
We're
exciting.
going for breadth and depth.
Yes. So we're waiting just for a few more questions, just to see. But wait, one is literally being typed as we're talking. So let's wait. This is like suspense, live time figuring out. Okay, this is great. Would there be any hands-on experience in the program similar to an internship?
So we have as a foundational part of the program actually 2 kinds of experiences that are hands-on, like an internship. One, everybody has to do an applied practice experience. So we're working right now behind the scenes to create a network of local departments of public health or community organizations like United Way that students, no matter where they are in the country, can work with in order to fulfill this applied practice component of every MPH that we offer. So that's one example. Another is that there's a capstone requirement. So that is actually taking the concepts and the foundational skills and now applying them to a single problem, getting your hands deep into the analysis of either data or policies or program planning and evaluation. So we would naturally have you partner with either alumni or other practice partners or with faculty that do this kind of work. So we've devised not only the core to have hands-on, the electives to have hands-on, but then also we've got these applied practice and capstone opportunities.
Another great question, can a student combine multiple electives?
You can. I don't think it would be as easy to do because, as I was saying, we've put an emphasis on making the courses sort of deep dives. And so you can do some mixing and matching, but you have to be ready for that deep dive. We don't want to send somebody deep into longitudinal modeling if they've never had basic regression. So we would work with you to make sure that you had what you needed in order to mix the electives up. But we're willing to work with you on sort of customizing your trajectory.
So I think that was our final question for now. We're almost out of time, so if we didn't answer your question and you're still taking time to formulate it, please keep going. Email it to the address that you'll see right here. That's our school address. I'll actually be the one answering it, so you'll know for sure it's being answered and you know who it's going to. And also be sure that you're signed up on our list to receive updates, and you can do that by visiting Coursera.org and following the URL there. Please be sure to keep in touch with us. Always, we're consistently updating things. Like, this is still a living thing. It's still growing out. It's still coming out in progress. So if you want to be most up to date, I mean, stay on touch through the email, of course, but there's also connect with us on social media. Our handle is UMISH on Twitter, Facebook, and Instagram. So
Yeah.
that's easy to remember. And then please be sure to just check out our main website, sph.umich.edu, and learn more about what we're doing, and who's the community that you're thinking of joining. What are the things that we're doing? What are we innovating? And then get excited about what you can innovate with us together. And be sure to look at the Pursuit, which is discussing current trends and work that our staff, faculty, and students are doing. And they're also posting articles on there from themselves. So I think it's a great thing as you're looking at the program to hear from the students, from the community itself. So be sure to check that out.
All right, we'd like to thank you all for joining us today and for your interest in the University of Michigan School of Public Health and the online program. We'll address whatever questions that have been posted sort of later on, so stay tuned and be on the lookout. We'll have some more live sessions in the upcoming months, and thanks for joining us.
Thank you.
Go Blue!
Go Blue.